the relatively newer treatment options which has come up in bladder cancer, if we start from the non-invasive, non-muscle invasive bladder cancer, then we have been typically using BCG, which has been very important in this setting after doing, removing the tumor from the bladder. But it has been troublesome for our patients. So there has been some good development about having other chemotherapy drugs like docetaxel, gemcitabine, which has been a relatively newer development and which appears to be far more safer and far more tolerable for our patient in this setting. Subsequently, if we take a relatively bigger tumor, then we do, as you heard from me, that we do surgery in this setting. There has been a good development as far as the reconstruction is concerned, and that's what we call neobladder in these patients, and that has been a very significant development. If you take older data with the surgery of removing bladder, almost 1 out of 5 patients used to die after surgery, and now the data is that it is not more than 10%. In fact, that's not considered good if you have more than 10% people having mortality post-treatment because of the complications. So there has been a lot of improvement in the supportive care and this reconstruction to have improvement in the outcome of these patients. Apart from this, in these those locally advanced patients, there has been an important development that after doing chemotherapy and surgery, the patients, if we give immunotherapy, then the disease control is far better than what we have seen in the past, and it appears the disease control becomes almost double as far as the median disease control is concerned. We are waiting for increase in life data to be up and available, but it's not available at this moment. We also have been good development for bladder preservation. As we know that we don't want to lose our organ, and that's the usual we hear from our patients. So there has been a good development how you can do smaller surgeries. Also, can you use alternative tool like radiotherapy combining with the various chemotherapy drugs, which are safer, and they can have a bladder being preserved and having a similar outcome. And those development also has happened relatively recently. And apart from that, in advanced stage, that is where we treat with the palliative intent, there has been good mutation data which is there, which has helped us in knowing the biology of the disease and also developing a treatment which is effective in this setting. And so because of those development in metastatic setting also, you do have an option not only in first line treatment patient, if they fail second line or if they fail third line, those treatment options are available in this setting. And these are relatively newer development in bladder cancer.